Hello students, here are the MCQS from oral cavity cancers. 1. A 55-year-old male presents with a non-healing ulcer on the lateral border of the tongue. He is a chronic smoker and alcoholic. Physical examination reveals a 2 cm ulcer with indurated edges. What is the most likely diagnosis? A. Squamous cell carcinoma. B. Leukoplakia. C. Oral lichen planus. D. Oral candidiasis. E. Aphthous ulcer. Answer: A. Squamous cell carcinoma. 2. A 45-year-old female reports a persistent sore in her mouth and difficulty swallowing for the past 3 months. She has a history of betel nut chewing. Which risk factor is most strongly associated with her condition? A. Tobacco smoking. B. Betel nut chewing. C. Excessive alcohol consumption. D. HPV infection. E. Poor oral hygiene. Answer: B. Betel nut chewing. 3. A 60-year-old man with a history of heavy alcohol use presents with a painless, firm mass on the floor of his mouth that has been present for 2 months. What is the most likely histopathological finding? A. Adenocarcinoma. B. Squamous cell carcinoma. C. Melanoma. D. Lymphoma. E. Sarcoma. Answer: B. Squamous cell carcinoma. 4. A 50-year-old woman presents with a white patch on the buccal mucosa that cannot be scraped off. She denies any pain but reports a history of smoking. What is the next best step in management? A. Reassurance and observation. B. Topical antifungal treatment. C. Biopsy of the lesion. D. Antibiotic therapy. E. Oral rinse with chlorhexidine. Answer: C. Biopsy of the lesion. 5. A 63-year-old male with a history of tobacco use presents with a growth on his lower gum. On examination, there is a firm, non-tender lesion with an ulcerated surface. What is the most common location for oral cavity cancer? A. Tongue. B. Floor of the mouth. C. Buccal mucosa. D. Gingiva. E. Hard palate. Answer: A. Tongue. 6. A 48-year-old man presents with a red and white patch on his tongue that has been increasing in size. He has a 30-year history of smoking. What is the term for this type of lesion? A. Leukoplakia. B. Erythroplakia. C. Lichen planus. D. Fibroma. E. Mucocele. Answer: B. Erythroplakia. 7. A 52-year-old female presents with a painful ulcer on her tongue and a history of poorly fitting dentures. Question: which of the following is a common initial symptom of oral cancer? A. Painful ulcer. B. Swelling. C. Persistent sore throat. D. Difficulty chewing. E. Loose teeth. Answer: A. Painful ulcer. 8. A 70-year-old male presents with a growth on his lip that has been gradually enlarging over the past year. He has a history of extensive sun exposure. What type of cancer is most likely in this patient? A. Basal cell carcinoma. B. Squamous cell carcinoma. C. Melanoma. D. Merkel cell carcinoma. E. Kaposi sarcoma. Answer: B. Squamous cell carcinoma. 9. A 58-year-old woman presents with a persistent sore on her hard palate and a history of smoking and alcohol use. Biopsy reveals malignant cells. Which virus is commonly associated with oral squamous cell carcinoma? A. Epstein-Barr virus. B. Human papillomavirus. C. Herpes simplex virus. D. Cytomegalovirus. E. Varicella-Zoster virus. Answer, B. Human papillomavirus. 10. A 65-year-old male presents with a growth on his tongue. He has been a chronic smoker and drinks alcohol daily. The lesion is found to be squamous cell carcinoma. What is the primary treatment modality for this type of cancer? A. Chemotherapy. B. Radiotherapy. C. Surgery. D. Immunotherapy. E. Targeted therapy. Answer, C. Surgery.